members of the Presidential Task Force, distinguished ladies and gentlemen, I welcome you all to the national briefing by the Presidential Task Force on COVID-19 for Monday, 12th of October 2020. The Presidential Task Force is glad that the economy is opening up the more, but we continue to warn that as we continue to study developments in Europe and other parts of the world, no nation can be said to be immune to a possible second wave if the guidelines and protocols are not adhered to strictly. Therefore, Nigerians need to anticipate this and also prepare for it. Our hope and prayers are that it shall not happen. For our proper information and guidance, the picture from around the world can be summarized as follows. Over the last few days, global cases crossed the 37 million mark. So there are over 37 million persons confirmed as having been infected by COVID-19. In the UK, cases have been on the increase, and the fifth highest number of daily cases were recorded on Sunday 11th with 12,872. Similarly, Brazil's case load has also continued to increase with the registration of a daily case load of over 65,000 on the 11th of October. Over 65,000 infections in one day. On the African continent, 8,987 cases were reported from 34 countries in the last 24 hours, leading to a cumulative total case count of 1,587,276. Of this, inclusive of 38,116 deaths, bringing the case fatality rate at 2.4%. Nigeria maintains the fifth position with 60,266 in highest cumulative cases after South Africa, Morocco, Egypt, and Ethiopia. Before this week runs out, the Presidential Task Force shall unveil to Nigerians the next steps regarding the remaining phase of the eased lockdown. As you were informed last week, findings and recommendations have been compiled and will be presented to Mr. President in the 8th interim report shortly. The debate about safe reopening of schools has dominated the space of conversation by concerned citizens and parents. We wish to reiterate that the federating units have the responsibility for determining the dates and modalities for the safe reopening, while the federal government continues to provide guidelines. The Presidential Task Force and relevant MDS have made appreciable progress in the discussions with the European Union over flight restrictions and entry of Nigerian nationals and holders of long-term Schengen visas into the territory. We are making appreciable progress, and we hope to make a favorable announcement on this very, very soon. Before I round up, let me, as always, remind all Nigerians that together we must continue to take responsibility and remain vigilant and extremely careful, looking at the global picture with resurgence of COVID-19 in countries that we thought had flattened the curve and dampened the spread, now having to deal with even issues of specific and selective restrictions being imposed in those countries. So we cannot announce that we are out of the woods yet, as we see the experiences of other nations emerging. I now call on the Honorable Minister of State Health, and thereafter the DG, Nigerian Center for Disease Control, and the National Coordinator to provide us with updates, and if there are need for further clarification, the other ministers and other officials of the task force would provide those updates. I thank you for your kind attention, and have a wonderful evening.
Ladies and gentlemen, in the past 24 hours, Nigeria has recorded 163 new COVID-19 cases in 12 states, bringing the total confirmed cases to 60,266 out of 554,006 persons tested so far. 51,735 cases have been discharged, and 1,115 deaths have been recorded, sadly, in 36 states and the Federal Capital Territory. There are 7,416 active cases, most of which are currently receiving treatment either at home or in a care facility. We need to constantly remind ourselves that this is a new virus, and there is a lot to be learned. We continue to share our experiences and learn from the experience of other countries. Last Friday, the Honorable Minister of Health received the Cuban ambassador to Nigeria, Her Excellency Clara Pulido Escandel, who facilitated a virtual technical meeting between our two countries on our COVID-19 response. The meeting provided an opportunity for us to share ideas and learn from the Cuban successes in controlling the pandemic in a convivial atmosphere. We shall continue to engage with friends and partners using the lessons learned to improve our response, thus building on the gains we have made in controlling the pandemic. Our response remains to build around our strategy of trace, test, isolate, and treat. In this regard, training of health workers is ongoing across the country on infection prevention and control, contact tracing, and case management. The result of this is that the rate of infection among health workers has reduced, and more cases are being successfully treated and discharged. The COVID-19 pandemic has shown the value of a well-coordinated multi-stakeholder approach can bring to improved healthcare and underscore the invaluable result of partnership. Earlier today, we launched the Nigeria Reproductive, Maternal, Newborn, Child, Adolescent, and Elderly Health Plus Nutrition, RMNCAEH+N, a multi-stakeholder partnership coordination platform to harness the relative strength of diverse stakeholders and create huge opportunities to leverage resources towards maximization of outcomes and attainment of shared vision for Nigerians. This is particularly important for the vulnerable population, most of whom are women, children, adolescents, and the elderly. We are delighted to note the commitment of our traditional rulers to issues concerning the health of our women, children, and the vulnerable. This was again displayed today as our royal fathers from different parts of the country spoke with one voice in support of reproductive, maternal, newborn child, adolescent, and elderly health plus nutrition. We thank them immensely, and we shall continue to count on their support. Finally, we shall again remind ourselves that this pandemic is not over yet. We all owe it as a duty to ensure that we protect ourselves and protect others. Wear a mask when in public places, ensure physical distancing, and observe respiratory hygiene. I thank you for listening.
The Federation and Chair of the Presidential Task Force, Honorable Ministers, DGs, gentlemen of the press, thank you again for coming out for this press briefing. Right now, like you know, we're focusing on mitigating the impact of COVID-19 on many aspects of our economy. Working together with aviation, the aviation ministry, we've more or less successfully reopened that industry and now working towards reopening it fully. There's still some limitation on certain flights. The next critical area, walk of life that we've been working on is education, working closely with the Ministry of Education and states. States play a big role in this. We understand the implication of education to our national development and have continued to carry the country along in all our plans in ensuring the safe reopening of schools. Our aim has been and remains to halt the spread of this disease in Nigeria while ensuring that sectors recover quickly and we can move forward as a country. Therefore, the PTF has ensured that the phased, safe, and gradual reopening of various sectors continues, including, critically, the education sector. As Nigeria's national public health institution, we are aware of our responsibilities and have continued to provide guidelines in line with global best practice to ensure Nigerians are safe as we adapt to the new normal. But these are challenges every country around the world is facing. There's been no precedent, there's no best practice, so we're all learning at the same time. Reopening of schools will unquestionably bring benefits to students who have been at home for many months now, and to the wider economy. So in the past few months, we've been working with the Ministry of Education, schools and states, and many other stakeholders, critically parents, to ensure that the reopening of schools is safe as possible for our children. As a parent myself, I understand the anxiety and concerns that parents have, and I would like to reassure Nigerians that as schools reopen in various states, the safety of our children and school staff is a priority to the federal government of Nigeria. So remember that at the beginning of this outbreak, we had really limited knowledge on this new virus, and like the rest of the world, on the transmission dynamics of the virus. and critically, how it affects children. The virus behaves differently from most other viruses that we know, where transmission has always been primarily driven by children. But now we're better informed and continue to adapt our guidelines as new knowledge emerges. Drawing from what we now know in our context and in our country, with our experiences to date, we have worked with the Federal Ministry of Education to develop new guidance for the safe reopening of schools across the country. We've put this in a very simple format, so every school can pick this up across the country and adapt it to its own uses. We've done this very carefully, recognizing that the resources, opportunities of schools differ around the country, but really focusing on the principles of what needs to be done. Some schools will get there earlier, others will get there a little bit later, but the key thing is that we are all moving in the direction of safe reopening of our schools. These guidelines include strong recommendations around regular risk assessments, sharing updates of the medical status of every student, a clear communication plan, so that when there's an outbreak or when there's a cluster of cases, schools know exactly what to do, who to inform, how to respond. Advice on designated hand-washing areas, triage of patients, sample collection, all these critical questions that every school in Nigeria will be asking. How are we going to do this? The more detailed guidelines are the detailed guidelines on school reopening that are on our website, but this really gives, in 2 pages, some simple guides to everyone to use. We have taken into account the context in various schools and how we are going to achieve this in our own environment with our own limitations. So, in conclusion, I'd like to emphasize that there's evidence that though there's evidence to show that younger people appear to be less at risk for COVID-19, low risk does not mean no risk. And we have seen this virus being transmitted in children, even though it's not transmitted as intensively as in adolescents and adults. Therefore, there must be synergy between parents, school authorities, state ministries of health, state epidemiologists, and the federal government to mitigate the impact of COVID-19. I would like to particularly thank the Federal Ministry of Education and all the colleagues that we've been working very hard across the country to reach some consensus on what needs to be done. Now we have to move forward, reopen our schools, get back to school, but try and do it as safely as possible to mitigate the impact of this virus. We're learning from other countries where some reopened too aggressively and had to shut down educational settings again. So we're going to try very hard to do this safely, do it in a way that we can reopen our schools, but also continue protecting the health of all Nigerians. Thank you very much.
Honorable Ministers, members of the PTF, gentlemen of the press, good evening. Well, it looks like school is the main topic today because I'll be re-echoing what DG and CDC just said. We haven't been able to share our paperwork, otherwise we would have taken a different topic. But this remains extremely critical and important, especially this week as more and more schools open. With the reopening of schools, the PTF remains concerned about the long-term impact of COVID-19 on education and eventually our economy. As of today, we are approaching about 600,000 Nigerians having tested for COVID-19. This might sound like a huge figure, but it's actually quite low. Our target is for every state to test at least 1% of its population. Only the FCT has achieved this target. Lagos is fast approaching with about 97% achievement, but other states are barely above 20-25%. So what it means is that most of us do not actually know our status. And this becomes even more important as we continue to relax our restrictions. We know coronaviruses spread silently and they spread quickly, which is why we must follow safety measures at all times, especially in our schools. As mentioned by DG and CDC, both the NCDC, the Federal Ministry of Education, PTF, and state authorities have been working very closely to make sure that the guidelines we produce are relevant to our setting and will also enable us to continue on the right track of keeping on top of the pandemic. In terms of the guidelines for schools, we must have our children back to school in a manner that is safe and manageable. We do know that the best way to deliver education is to have students in the classroom with their teachers for support. It's been a long while. Schools have been closed for quite a while. And during their closure, to a large extent, we have done what we can with distant learning. But it is now time for schools to resume. For the safety of students, teachers, and staff, schools must have detailed communication protocols that include parents, staff, school health teams, school authorities, and local/state officials. They must also provide regular updates to parents, staff, and relevant authorities, as well as communicate changes to their procedures effectively and clearly. Schools must also take sufficient measures to understand how COVID-19 can spread, how to mitigate its transmission in line with official guidelines, and where they have a positive case, they need to know how this should be managed. There are creative solutions available to schools, which I mentioned last week. There's no doubt education is a fundamental human right, and we must do what we can to ensure that it is available for all Nigerians and that we respect the right of citizens to education. We must also take responsibility to minimize the risk of transmission, protect our young people and their families for the schools to be able to operate effectively. Each of us has their own part to play. It is definitely time for Nigeria to get moving, and in this regard, we have to support our students. And we also have to protect our schools, because by protecting our schools and educational system, we also protect our future. Thank you.
Thank you very much, National Coordinator. As of now, we do not have updates. Maybe later on we are going to have. Let's now...
Colleagues in the PTF and media representatives here present, and ladies and gentlemen. Yes, I have two questions. The first from Nancy, AIT. Well, you're referring to the development of a rapid PCR-based test developed by Nigeria Institute of Medical Research, NIMA. You want to know how soon will it be readily available. I think it's just a matter of how soon the funding is available. And I do know that NIMA is reaching out to everywhere that it can reach out to, even to PTF, to Central Bank, and to some other people, even in the private sector. You recall that I did say then that this was something funded initially, or the seed money to carry out that project was given by a private foundation. So it's something that we need, and I do know that efforts are being made across board to making it available, particularly at the point of care, because that is where it is most needed. So the NIMA officials are working hard in that regard. I cannot give you a time element saying in a month, in 2 months, or in 2 weeks, but what I know is that efforts are being made to fast-track that process and ensure that it is available for the use of Nigeria and, of course, Nigerians as well. So we will keep on pushing, and we will do all that is needed to be done to make it available soonest. So I'm sorry if I'm unable to give you a particular. I wish the DG NIMA himself were here to give you probably something more specific. But for now, I think it suffices to say that necessary
face masks. Masks like this one and like the one you're wearing should be worn only once. Sometimes, if you can afford it, change it a few times during the day, but at maximum a day, and then you discard it. The most cost-efficient way, actually, for members of the public to wear masks are to wear cloth masks and wash them every evening. Or have a couple or 3 that you wash and reuse. The last time I appeared here, I was wearing a cloth mask. So they do have advantages, but probably aesthetically look even better. So I really advise members of the public, if there are difficulties in changing your masks every day, please use cloth masks. They're the best thing to use every day as we have to. The second question was on the lab in Kogi. We've had a lab activated in Kogi for over 2 months, 2.5 months. We supported, provided equipment, went there, trained, stayed there for about 3 weeks, working with the state team to make sure they had the capacity to test. We tested quite a number of samples at the time. There was difficulty getting sufficient in, but we got enough in to make sure that they had the capacity to test. But the role of NCDC is not to run any lab. So we make sure you have the equipment, we provide the training, we provide the reagents, and then it's up to the institutions to continue testing. So testing has been very slow, but as always, I keep saying we're always ready to support. We're always there to support, and we'll keep supporting every state in Nigeria to build up its testing capacity. But we do have at least a lab in every state in Nigeria. In some states, multiple labs, some states, private, public, federal, state institutions, more than enough reagents now to test as many samples as we need to. So the capacity to test is not our challenge right now, and really it's about keeping up the momentum of a few months ago of getting the samples into the labs. And many states are doing very well, actually. So thank you very much.
Some of them are related. So the first one has to do with civil servants are still at home. So we will be rolling out the next phase of the response, the details on Thursday. We're still in discussion with the Office of the Head of Service. And over the next few days, we'll take a decision. But we'll also need to clear with Mr. President and get the necessary approvals. Having said this, we remain very concerned about the level of compliance, particularly with wearing face masks in offices, including government offices. And to the PTF, this is really not acceptable. And we'll be reaching out to the heads of MDAs to emphasize this point. If all civil servants are going to come back to work, we expect 100% compliance with the wearing of face masks in government offices as well as commercial premises and other public spaces. The other questions have to do mostly with the issue of the portal. First of all, I'll start with the issue of the young man lamenting about filling forms. This is exactly the reason why the portal was created. If the portal at the moment is working very well, I've had calls from outside the country from people who are struggling to use the portal, and we went through it within minutes. We were able to get them onto it and to upload the QR code, etc., without any issues. So sometimes it has to do maybe with the internet that you're working with or you're using abroad. Sometimes it has to do with simple things such as the use of international cards. If you have an international card and you're paying in Naira, obviously it will not go through. And we also know that there are issues with some of the US Visa credit cards. And at the moment we are working towards creating additional payment portals that would enable those with international cards to pay. But the portal, the way it is, when you go in, there are 3 sections. The first section has to do with filling the health questionnaire. And that's very straightforward. It will then take you to the next section, which has to do with uploading your COVID-19 PCR result that should be negative at the point of boarding. At that stage, you have 2 options, either to go ahead and pay or to download your QR code. If you choose to download your temporary QR code, you can print it and board with it to come into Nigeria and then subsequently pay. But our strong recommendation is, if you do not want to spend too much time at the airport, go ahead and pay and print out the final QR code. If you have the final QR code, it takes minutes to clear the airport. Minutes, literally. It's very quick. And we have everything online. We have your health questionnaire online. We have your COVID-19 PCR result online. So if there's a problem at day 7, we test you and your COVID result is positive, we can easily go back and check whether the result you have on your system, it looks like a genuine COVID PCR result or not, and also check your health questionnaire to see whether maybe you have admitted that you may be having some symptoms prior to boarding, and that's been missed. So we are able to check and go back and find out the reason why you may have a positive result at day 7. Is it because you are incubating the illness, or you've just picked up the virus on your way in, or is it possible that you did the wrong test, such as an antigen test instead of a PCR test? In the coming week, we will be notifying airlines that for passengers that do not have a QR code, whether this is a temporary QR code or the permanent one after paying, passengers will not be allowed to board airlines. We are going to stop the use of paper in the airport, because this is one of the issues that's causing congestion, and Nigeria is no different to other countries. If you are going to other countries, you fill your health questionnaire online, you do whatever you need to do online and submit. And we should be no different. We should be joining the 21st century. We are increasingly confident that the portal is working well. You do not need to pay in order to generate a QR code. But the earlier passengers get used to the portal, the better, because it will make it easier for us to manage passengers, especially now that we are opening and increasing the number of passengers coming in. We've already increased the number of passengers in Lagos to 2,500 a day. We've increased the number of passengers coming into Abuja to 1,600. That's just over 4,000 passengers every day. We cannot handle paper with this sort of level of passengers coming in. So no more papers very soon at the airport, and people will have to use the portal. The other question has to do with the need for a test at day 7. So as I've always explained, the incubation period for COVID-19 is between 2 to 14 days. Incubation period means the time you require between when you acquire the infection and when you develop symptoms. On average, it's about 7 days. For most people, the median is 7 days. Most people will get symptoms 7 days after catching COVID. So if you catch COVID, not that I'm praying that any of you will catch COVID today, but it will be exactly a week from now, on average, that people will develop the symptoms. And that's the best time to test. For travelers, we ask for a COVID-19 PCR result pre-boarding to be done as close as possible to the point of boarding the flight. The reason being that when you arrive Nigeria, it will reflect your true status. So we say initially within 72 hours, most countries say 72 hours. We had to relax it to 5 days in order to accommodate those coming from significant distances or those that are transiting long-haul flights, etc. But by the time you arrive Nigeria, the PCR result you are holding in your hand, which says it's negative, should give us the confidence to say, yes, you're likely to be negative. However, if you were to pick up COVID on your way to the airport, if we test you at the airport on arrival, you will still be negative if you have that negative PCR prior to that, because it's too early for the test to become positive. Which is why we say, go home, self-isolate for 7 days, and we will test you at day 7. By day 8, you will get the result. If it is positive, it means you must have either picked up COVID very close to the point of boarding, or you were incubating the illness and you became symptomatic around day 7. And indeed, when we tested the first 2,403 passengers in Lagos, 80 of them were positive, 3.3%. And of those 80, all the 80 had negative results for COVID on arrival. When we looked at Abuja, the first 2,700 or so passengers that we tested, 25 of them were positive, which gives a positivity rate of close to 1%. So if you combine that, we had 105 passengers that were positive of the first 5,000 or so that we tested. What does that mean? It means that if we were to test those 105, because they all had negative PCR results on arrival, remember, if we were to test them at the time of arrival, less than 10% of them would have been positive. So out of those 105, we would have picked up less than 10 of them if we had tested them at the airport on arrival. But by delaying the test to day 7, we've been able to improve the yield and pick them up at day 7. And at day 7, you pick up 96% of those that would have seroconverted. So we are confident that even if we missed, we probably missed just 4% of those that would have come up positive at day 14 if we had continued to test at day 14. Maybe there might be another 3 or 4 passengers that we may have missed that will maybe positive at day 14. But we can live with that. We can live with 4%. Because we know that the majority of passengers will find it difficult to self-isolate for 14 days. And let us be frank with ourselves. 2 weeks quarantine after you have come from abroad, how many people will be able to keep to that? But by testing at day 7, we're able to pick up those that we need to concentrate on and isolate them, identify them, isolate them, and keep our country safe. And remember, when the airports open fully, we'll be having between 5,000 to 7,000 passengers coming in every day. That translates to between 100 to 150 potential new introductions into the country every day. If we do not do anything, it will draw our COVID response back. And we have to identify passengers that are likely to be positive and isolate them straight away. Now, the question had to do with the second part of the question is, if you are staying for less than 7 days, why do you need to test? If you are in Nigeria for less than 7 days and you're leaving the country, fine, you don't need to test. That test is on day 7. It is not on day 1 or day 2 or day 3. But having said that, we don't even expect you when you come into the country to start running around. So what did you come in for? If you're coming in as a short-term visitor, You have to stay for 7 days, self-isolate, make sure you're negative before you start mixing with people. So why are you coming into the country for 2-3 days and then leaving? So again, the pushback is you do not need to test if you are staying in the country for less than 7 days. But what did you come into the country to do for 3 days? At the moment, we are not giving visas for short-term visitors. There's nothing like short-term business visits, etc. We don't have any exceptions at the moment. Laboratories outside Abuja. If you pay for a test, you choose an Abuja lab. It is the responsibility of the lab in Abuja, wherever you are in the country, to get you sampled. It's their responsibility because you have already paid for it. That 36 or 38 or 39,000 you paid includes the logistics for the lab to make sure that you are tested wherever you are in the country. So you have already paid for that service. If it is not being provided to you, you should let us know, and we will take action with the relevant laboratories.
600, maybe more, because if you divide the 60 by 36, you will get 1,621. Now, we know the state are not the same in size or number of schools or population. So based on that, we said 1,000 and then more, depending on the side of the school. So that is the modality, if that is what you are talking about. Jama'a assalamu alaikum. Tambayan da aka yi
PTF, members of the PTF, member of the press. I had two questions. The first one is regarding the role, the potential role of banknotes and mobile phone in the transmission. As you know, early in March this year, WHO published a scientific briefing where it was clearly stated that the main route of transmission is through respiratory droplet, where a person infected coughs or speaks or sneezes. But also, WHO highlighted the role of fomite, inanimate objects, like banknotes or mobile phone or even door handles. And that's the reason why, in addition to the advice for wearing masks in public places, there is this advice that's still relevant to wash hands frequently with water and soap, or to use hand sanitizer. And it has been observed indeed that transmission through fomite was quite frequent around persons who were infected. We've heard some instances where people will remember one person infected passing by an environment just briefly. And then after that, we'll count some people infected around him. So most likely, the role of fomite could be blamed in that case. So it's true. And that's why in Nigeria and in many other countries, it's strongly advised to use non-cash transaction of payment method rather than using banknotes. And of course, it's important to continue to observe other measures and washing hands frequently. The second question was about the long-term effect of COVID-19. What I would like to say, as you know, it's still a new disease. We are still learning quite a bit of it. But there are already some publications that do suggest that there are some long-term effects. There is a proportion of patients who state, mostly through telephone interview, that they never recover the level of health they had before. Some report chronic fatigue, other report problems with the lungs due to damaged lungs, other report cardiac problem, others have issue with the nervous system and with the senses, some lost the smell, etc. And then chronic fatigue, and some even experience heart attack or stroke. So we are still studying these long-term effects. And if you compare to similar virus, the coronavirus in the past, and some patients reported long-term effect, even 24 to 36 months
after the disease. So it's a condition that we need to continue to monitor through survey with those that have been affected. Now, as to the impact on the African continent, as you know, the African continent overall appeared to have been spared. I mean, the catastrophe that was predicted didn't happen. But it doesn't mean that those at risk are not experiencing, those at risk who were infected are not experiencing those long-term effects. So we need to continue to monitor and support them. And this is why, even though we are seeing decline in a number of cases, and even if we don't have any obvious sign that the transmission is still intense, we need to continue to observe this measure as a gesture of solidarity to those who have underlying conditions that will remain at risk. And we don't know how the COVID-19 will exert its impact on those who have underlying condition, and which we need to know in our community and continue to support them. Thank you very much for your question.
I think almost everything that was asked has been answered. The meeting we had with the governors was exactly what the Minister of Environment said. They will go out and they will, environmental health sanitation officers will inspect the schools, they will see what has happened. The commissioners of education have already reported back on what is available in each of the states. And as you are aware, at the very primary level, only the states operate at that level. So 100 and nearly 20,000 primary schools around the country will be what will be in focus. Most of the actions that all of them are going to be getting, because the first question related to those that are in rural areas, that guidance has also gone out to everybody. It's the same guidance that the WHO and NCDC have been talking about. That's the same that we reformatted, put them in the form of a template and sent it out to every part of the country. That compliance is expected, and our inspectorates are also ensuring that every state then does just feedback with that same template. There are no special templates for those in the rural areas. We're trying to communicate them using the same instrumentalities of governance to reach them at whatever fringes there are. So the same guidance goes to everybody. Thank you.
It's very important that as we open up most of the sectors of the economy and even our social lives, that we should remain mindful of the fact that COVID-19 is not abating in any way. We might have seen low figures, but I have consistently maintained this position that that cannot be a true reflection of what is happening on the ground. Because of the number of samples we collect on a daily basis and the tests that we run, there are several states that are extremely quiet and silent in the last couple of weeks, running into months. And that should be a major source of concern. Why is there a resurgence in places where we thought that they have overcome COVID-19? I know it's a novel virus. Not very much is known about it. Our experts are still studying the character and the nature of COVID-19. We've improved in our clinical care because our doctors in our health facilities are doing a wonderful job. You can see the case fatality rates dropping by the day. But I'm not quite oblivious of the fact that the dangers are still there. In spite of everything a president of a nation has, he got infected. The most protected territory on the face of the earth has become a super spreader. So we can't take anything for granted at this moment. Yes, God has been so gracious to us. We can see that we're doing very well. It has helped us to reconstruct the health infrastructure. Mind you, when we started, we had only 2 laboratories, but today we can talk about 70 laboratories spread all over the nation. There's hardly any state that does not have a testing center. So it means that in spite of the adverse effects of COVID-19 and the disruption it has brought to our civil life, it has also created an opportunity for us to begin to put in place strategic features that will help us confront any other form of pandemic that comes on the surface at a later date. I believe, and I know when we started, there were so many comparisons with a lot of countries that were able to test more at a given time. But we were quick to forget that they had built infrastructure. And that is what we are trying to do, to ensure that in the processes of fighting COVID-19 through the national response, we're also addressing the issues of reconstructing our medical infrastructure, looking at our governance structure, so that as much as possible, nobody is left behind. That policies going forward would take cognizance of the fact that there must be inclusivity in everything we do as a nation. So, what is the way? The only known cure to COVID-19 today is staying with the non-pharmaceutical interventions that have been put in place. Wearing of masks, keeping social distancing, maintaining personal hygiene by washing of hands and the use of sanitizers, and avoid